Good morning, everyone. My topic is correlation of HbA1c level with diabetic macular edema in a tertiary care hospital. The term diabetes mellitus describes a metabolic disorder characterized by chronic hyperglycemia with disturbance of carbohydrate, fat, and protein metabolism. The disease has acquired the status of global pandemic. The number of people with diabetes in India currently around 101 million, and India is now the diabetes capital of the world. Diabetic retinopathy and diabetic macular edema are common microvascular complications in patients with diabetes and may have eventually leading to blindness. The level of glycemic control in patients with diabetes has been linked with occurrence of macular edema. The WESDS showed that 1% decrease in the HbA1c from the baseline to the 4-year follow-up would be expected to lead to 25% decrease in the 10-year incidence of macular edema. The aims and objectives are to study the correlation of HbA1c level with diabetic macular edema, qualitative and quantitative assessment of macular edema using OCT, and to correlate the foveal thickness with the HbA1c level. The inclusion criteria: diabetic patient as diagnosed by the ADA guidelines 2022 having various grades of retinopathy were included. Both sexes were included, age between 10 to 70 years. The material answer method: this is a cross-sectional study was conducted in the Regional Institute of Ophthalmology, Guwahati Medical College and Hospital during the period of February 2022 to March 2023 in collaboration with Department of Biochemistry and Endocrinology. The patients were selected from the outdoor as well as indoor of the Regional Institute of Ophthalmology, Guwahati. The total of 140 patients were taken and divided into two groups based on presence of and absence of macular edema, 70 patients each. A complete history was taken, general examination and systemic examination, and signs of any complication of diabetes were noted. Ocular examination was done very meticulously in every patient with the following emphasis: visual acuity, intraocular pressure, detailed ciliary examination. The pupil was dilated with topicamide 0.8% and phenylephrine 5% eye drops, 1 drop thrice at 15 minutes interval, and detailed posterior segment examination was done with direct and indirect ophthalmoscopy, ciliary biomicroscopy with 90D lens. Fundus photographs were taken with the fundus camera and grading of retinopathy was done. OCT imaging was performed using the Stratus OCT machine model 3000 Carl Zeiss machine with software version 4.0. Laboratory investigation was done: routine examination of blood, hemoglobin, TC, DC, and ESR, routine examination of urine for sugar, albumin, partial cast, and RBCs, serum separation of FBS, PPBS, serum creatinine, and glycosylated hemoglobin estimation was carried out by modified chromatic method. Coming to results, in group 1, the age of patients entry were 24 to 70 years, and the largest number of patients, that is 32 patients, were age of 50 to 59, followed by 17 patients age of more than 60, and lowest two number of patients with the age between 20 to 29. In group 2, the age of patients ranges from 18 to 70 years. The age group 40 to 49 years are maximum number of patients, that is 26. In the out of 70 patients in group 1, 14 were female and 56 were males. In group 2, 19 were female and 51 was male. So more number of male patients was found in our study in both groups. In group 1, the longest history of diabetes was 25 years and the least was 6 months. So the mean duration is 11.51 years. In group 2, the mean duration is 9.39 years. The longest history was 22 years and the least was newly diagnosed diabetes patient. In these results, we can see the insulin and oral hypoglycemic agent in group 1 is 34 patients out of 70 patients, and in group 2, insulin was taken by 21 patients out of 70 patients. So p-value come out 0.0378, which is significant. And the lifestyle of the patient: moderately active is 99 patients, sedentary was 22 patients, and active patients were 19 out of total 140 patients. In grade of retinopathy, mild NPDR is seen in group 1 2 patient and group 2 in 18 patient, moderate NPDR in 41 in group 1, 47 in group 2, severe NPDR in 14 in group 1, 3 in group 2, PDR in 13 in group 1 and 2 patient in group 2 patients. In OCT patterns in CS, those patients having CSME, the total number of eyes is 70 and the cystoid was 70, serous detachment was 8% and ventricular traction was 4 patient. Now coming to HbA1c level and HbA1c level and diabetic macular edema, the mean HbA1c level is 9.343 in group 1 and 8.42 in group 2, and standard deviation was plus minus 2.2 in group 1 and plus minus 1.5 in group 2. And the maximum HbA1c level was 15.3 and foveal thickness was 542 millimeter and minimum was 5.9 and minimum foveal thickness was 266 micrometer. Now coming to discussion, in our study the mean HbA1c group 1 is 9.343 and group 2 is 8.427 and the p value is coming out to 0.0047, which is considered significant, and this is also shown in the study of WHDR. We also correlate the foveal thickness with HbA1c level, and the correlation coefficient is 0.2258 and p value is 0.0602, which is not that significant in our study. In the present study, the group 1 14 were females and 56 were males, so it is found in more in males patient, which is also seen in the another study. And in our study, mild NPT are present in 2.86% in group 1, 25% present in group 2, moderate NPT in both groups was 58% and 67% respectively. CVD NPT is 20% and 4% in both groups, and PDR is 18.57 and 2.86 in both groups respectively, which is also seen a study in the Young et al. So in conclude, we can say hyperglycemia is the most important modified risk factor with diabetes. There has been a more widespread availability and standardization of HbA1c level in recent years. High mean glycosylate hemoglobin levels were significantly associated with development of macular edema in patients with diabetic retinopathy. Also, glycosylated hemoglobin levels have been positive correlation with foveal thickness on OCT, though not found statistically significant in our study. Even new risk factors and mechanisms of disease have come into light, but HbA1c level and glycemic control is more valuable in diabetes patients. There is no conflict of interest, no financial support. These are my references. Thank you.
Thank you. I think all papers are over. Now we are looking for keynote address by Dr. Aishwarya Mohanty, who is the AIOS Diabetic Retinopathy and Medical Retina Award winner in first midterm conference, Patna. So the topic is OCT, can it be a predictor of eclampsia? Please.
Yes, sir. Good afternoon, everyone. Myself, Dr. Aishwarya Mohanty, is going to present on OCT, can it be a predictor of preeclampsia? There is no financial interest. Preeclampsia, being the leading cause of maternal mortality, especially in developing countries, has a prevalence of 3 to 8% of pregnancies. As we know, it is a multi-system disorder. Coming to pathophysiology of preeclampsia, reduced blood flow to placenta due to fibrosis of the spiral